Good day. My name is Dr. Andrew Chang. I'm an orthodontist based at Smiles and Faces Orthodontics here in Blacktown. On behalf of me and my team, I'd really like to welcome all of you today for attending our webinar. The title of my webinar today is How an Prompt Orthodontic Assessment Can Save You and Your Child Time and Money. In our practice here in the western suburbs of Sydney, we see a lot of kids and children and teenagers, and I suppose that provides me the benefit of hindsight in being able to provide some information for all parents out there with kids who have some crooked teeth and who are not sure what to do. So I get questions asked by many parents when they attend for the initial consultation. Among them is, when is the right time to start orthodontic treatment? Am I doing the right thing by waiting? How does early treatment provide value? And if they undertake early treatment, will my child need orthodontic treatment later? In our practice, the benefits of an early orthodontic assessment is peace of mind. And even if no treatment is required at that point in time, we do not charge for follow-up records in determining the best time for your child to start orthodontic treatment. Early assessment does not mean early treatment. In fact, in about 60% of the young children that we see, we place them on a recall list. In our practice, early treatment reduces future orthodontic treatment need, complexity, and future costs. And I'll be hoping to show you this today in this presentation. So, just a disclaimer here that the philosophy or rather the philosophy of every orthodontic practice is different, and seeing another orthodontic practice may result in an entirely different plan and philosophy. So, I thought the most important question I believe that parents should ask when they're seeing an orthodontist is, can I be assured of a high quality treatment result at the end? And rather than all this discussion of philosophies of each individual practice, does it address me, the parent, and my child's concerns first and foremost? If we have a look at the decision tree that we have in our practice of what makes this work, you can see that we do consider factors from the referring general dentist. If there is a referral, quite often in our practice we don't require any referrals from the general dentist. But you can see that more importantly, we have the parental concerns and the child's concerns that probably outweigh the dentist concerns much more. And this is important because it is really the child who will be wearing any appliance, and the parental factors which are important because the parent is with the child all the time. So their ability to understand what's going on is important for us, as well as the child's enthusiasm as well is important in the success of the overall treatment plan. So the first part I'd like to talk today is losing a baby tooth early. And I've put in these two pictures here because the typical scenario when a baby tooth is lost early is when there's a hole in the baby tooth and the baby tooth needs to be removed before it is due to fall out. So the picture here on your right hand side shows a teenager here, and you can see that in the arrows that I've pointed out, we are missing two adult side teeth which have not come through. And when an X-ray was taken, and these same adult teeth, they're actually embedded or impacted rather beneath the gums, and there's no chance that these teeth can erupt through when there's no space, as you can see. So often when we see them, in order to manage the teeth, manage the crowding, manage the spacing, sometimes extensive surgery is required to remove the impacted teeth. And you can see along the bottom here, we've lost some baby teeth early, and that back adult tooth has drifted forward on the bottom part of the x-ray here. So we saw him probably a few years after those baby teeth were removed. So that's a very typical scenario which can happen when a baby tooth is lost early and nothing is done. And even in this teenager here, there has been even more pronounced space loss. You can see there's along the bottom part, we've got, if you look on the x-ray on the left side, that black space you see there, we've even got less space, and we've got two adult teeth which have not come through, which are on the x-ray, and we've got slightly less space for one tooth. In fact, when we saw her, she already had one upper left adult tooth removed. But you can see that if we look on the photo on the right hand side, that left one has moved much more forward than on the right hand side. So to sum it up here, when a baby tooth when a baby tooth is lost early, the immediate back adult tooth does shift forward, and that can often happen quite quickly, literally within a couple of months, particularly on the upper teeth. That can lead to the impaction of the underlying adult tooth where the baby tooth was, and the resulting impaction can either lead to the eventual surgical removal of the impacted adult tooth or the exposure of the impacted adult tooth and full braces. So then if my a parent may say, so my child has an impacted tooth, what if I do nothing and I just simply wait? Well, I've showed these two pictures here. On the left hand side you can see that there's an we have the x-ray of a teenager who came into me, and you can see on the x-ray we had an impacted upper tooth, and when I looked at that, I could see that the in that area denoted by that red arrow, that overlying adult tooth would look actually quite short. So here we are. We had on the right hand side, you can see that we've placed braces on, and that's what the white bits are. So here we place braces on to open up space, and you can see that the short root is much more apparent, much more obvious, as denoted by the white arrow. So, and generally these that shortening of the root, that permanent shortening, is not accompanied by any pain. So it's only with a X-ray when they present that we notice an impacted tooth caused by space loss, caused by the early loss of baby tooth, and then it becomes obvious. So to sum it up, an early orthodontic assessment identifies and addresses these issues and can save time and money from extensive surgery and teeth removal or exposure. Exposure basically is a procedure where the a brace is attached to the tooth which is underneath the gums, and all through that it can also prevent damage to the teeth by preventing the impaction from happening. So I'd like to talk now about what I meant the beginnings of early space loss. This is another situation. I've shown you the picture early on where we had a decayed tooth that needed to be removed early, and that's one of the reasons why the baby tooth is lost early. But the other reason, and this is again not accompanied with any pain, so that's why an early orthodontic assessment is important, is that you can see on the right hand side we've already had, if you look on the black the red arrow and the black arrow, you can see that we've had marked space loss. The forward drift of the back tooth as shown by the same picture now inside the mouth on the right hand side, where the adult tooth has drifted forward because we lost a baby tooth early, and that adult tooth, the underlying adult tooth, is denoted by the black arrow. On the other side, where you got the on the other side, you can see where we got the dotted red arrow, we have early stage space loss. So basically the typical scenario is we have the adult tooth, which is starting to cause the early loss of the root of the baby tooth in front because of the position of that erupting adult tooth, causing it to be lost, and thereby the forward drift of the adult front tooth, causing space loss. So if we identify that at that early stage, then that can be easily rectified. And this is the X-ray of this different girl here, where we saw her early, and you can see the typical situation is that adult tooth, as denoted by the left picture under my mouse cursor. The adult tooth was erupting beneath the baby tooth, and what we did was we simply placed a small elastic band in between the back teeth over 3 visits, and that had corrected itself, preventing that baby tooth from being lost early. So it then comes down to, let's say that baby tooth is lost early, either through an early removal from a decayed tooth, or because it was just the adult tooth behind that was erupting in an abnormal manner, causing the baby tooth to be lost, as shown earlier. Well, there's a simple appliance that holds the space soon after the baby tooth is lost, and that's what we call a space maintainer. So along the bottom, I've got 3 pictures here. They're all different types of space maintainers, and again, depending what appliance we use, well, that depends on all the child factors, parental factors that we consider when we're deciding what is the best appliance. So this was adapted, this slide was adapted, or this decision tree was adapted from a talk that I gave to a group of general dentists, and you can see that there's quite a more complicated decision tree that we consider in conjunction with you, the parent, and the child. Here we have placed in one of the space maintainers. This space maintainer was fitted in this girl 8 months after the removal of the overlying baby teeth. So this was a situation where I only managed to see her, or rather she only came in to see me some 8 months after those baby teeth were removed. And you can see that when that x-ray was taken, when this new x-ray that we requested to be taken, you can see that on the black arrow, that adult teeth, and the red arrow, the adult back teeth have drifted forwards. On the lower picture, you can see that what happens is with that space maintainer in, which is, if we had to go back here, which is the one you see on the far right, that space maintainer with the 2 rings and a wire bar, that space maintainer was fitted in, and you see 1 year and 3 months after that, the underlying adult teeth have got enough room to appear on one side, and on the other side it's still coming through, but you don't see that significant space loss that we saw in the earlier pictures. And even then, let's say if that there was indeed marked space loss, and these early, if we see them early enough, we can regain that space with what we call upper front teeth braces. Just an important point, this option of upper partial braces to regain space, you can see on that black arrow where we've lost space for one adult tooth by the forward drift of the back tooth, we've completely regained that. So that adult tooth the underlying adult tooth erupted because we managed to push the adult tooth behind that back. Now this option is only available if we see them early. And just for your information, this boy did not require any further orthodontic treatment. So something like, which would be full upper and lower braces with possibly surgically removing that impacted tooth, turned out to be an early partial front teeth braces treatment for a shorter duration and no further treatment necessary. So this was completed 1.5 years ago, and we've seen him, and all his other teeth have erupted normally. So that's one of the other features that we do for any sort of early treatments, that we do tend to follow up the kids until all the adult teeth erupt, so we can sort of provide you the best decision on what to do next. The next thing I'd like to talk about are jaw problems. Now, jaw problems are basically bite problems where you see marked either marked discrepancies or marked front teeth overlap, or reverse overlap, or inside biting upper teeth. So it's a combination of all three. In short, these jaw problems are best seen early, between what we call 8 and 11 years old. So as a parent, probably the next question I can see you asking is, why? Well, in kids, when we see them between those years, the potential to modify the jaw growth is greatest when the jaws are still growing. And probably the easiest way to understand that is if you take a set of growth charts. So basically, growth charts are basically their growth in centimeters per year over on the y-axis or the vertical line, and on the horizontal line, their ages. Their peak in their growth occurs around the age of about 11 for girls and 13 for boys. So the boys is the blue arrow, and the 11 years is the red arrow for girls. And after that, there's a significant drop, as you can see in that curvature, significant drop in the growth rate. So if there's any sort of bite problems related to jaw sizes or jaw growth, we can the opportunity to modify that is best when there's plenty of growth available. Now, in terms of how to recognize jaw size growth problems, this was another slide that I gave to also a group of dentists in terms of identifying it. But suffice to say, if you notice as a parent, if you notice your child has got a large overbite, underbite, or narrow upper jaw, it does benefit from an early assessment. Now, early assessment may not mean early treatment, and at the very least, you have peace of mind. I wanted to show you in these 3 pictures, they're all different patients. In fact, the left one was the youngest, so she's the youngest. The middle one is a teenager in the mid-teens, and on the right side is the adult. And you can see the common thread in all of them is they have a large overbite. And the bottom pictures, they were all treated with orthodontic treatment. So the left one was treated with plates, the middle one was treated with braces and what we call some jaw guidance springs, and the right one was treated with surgery, jaw surgery. And they've all got a similar outcome in the end, but they have very different treatment plans. And in a nutshell, there is a greater degree of complexity and cost with treating at a later age. So it then comes down to, just to show you here, we have this 9-year-old child who had a large overbite and managed with plates alone, upper and lower plates. And this was taken a few years back, and I have the we had the pleasure of seeing her back again when all the adult teeth were through, and all the adult teeth erupted straight. So this is something that we can predict with some degree of certainty when they present. Now let's say she didn't have these sort of plate treatment, then the options available to her would increase in duration and increase in complexity and increase in cost. So which brings us to the question, when is the ideal time? Well, the ideal time to assess large overbites, as we mentioned, is before 11 years in girls and 13 years in boys, which coincides with the peak in the growth spurt. The next thing I'd like to talk about, by the advantage of having an early assessment, is we can prevent permanent teeth wear on the adult front teeth. And this is namely caused by two features in their bites. One is inside biting upper teeth, and the other is what we call deep bite of the upper front teeth. So to explain this, the early orthodontic assessment, or the one they're coming for the consultation, would first be identifying these sort of issues and then deciding what to do. And quite often, well, if there's no wear of the teeth, we may decide to monitor to determine the best time for appropriate management. This is a picture of a child with inside biting teeth, and you can see what's happened. Two things happen here. One is the lower front teeth rather gets pushed out, even to the extent where we sometimes even see receding gums from the front tooth being pushed forwards. But also on the other side of the opposing, on the top front teeth, you have permanent wear of the teeth edges, as denoted by the red arrows. These issues can be corrected quite simply, and the effect on the smile is quite dramatic and remarkable. As you can see in this this girl here, where she wore upper front teeth braces for a period of 12 months. But you can see leaving this uncorrected would definitely aggravate the potential of the wear of the front teeth edges. And in this other girl here with inside biting upper front teeth, or where the lower teeth are biting ahead of the upper front teeth, you can see the two lower front teeth have got pushed out. They've sort of become elongated, and correcting that with upper front teeth braces restores them to a healthy situation, apart from the benefits of having an improved smile. So that's the inside biting front teeth. I'd like to now talk about the deep bite, or deep vertical overlap of the upper front teeth. So before I do that, you may ask as a parent, what is the problem with worn front teeth? Why don't we wait? Why does it have to be treated? Well, first of all, as teeth get worn, you have issues of teeth sensitivity. And worn teeth edges, even if they have the teeth straightened, the teeth straightening does not replace the worn teeth. And the edges, sometimes having those short teeth or the worn teeth edges, it does detract from the great result achieved from teeth straightening. And even if the teeth are built up later with the dentist or the general dentist, it often means extra costs. And with anything that is not, that has to be built up, there is a finite lifespan, there is a limited lifespan, and there is ongoing maintenance costs associated with that, and therefore extra costs involved. So to basically illustrate that, I'd like to show you here three groups of photos here. On the very left is the youngest, and on the very right is the oldest, on the far right. And in the middle is a mid-teens. All of them have a deep vertical overlap on the front teeth, or what we call a deep bite, and all of them have got wear of the adult front teeth. And what I've done here, I've highlighted the wear with a blue arrow, and on each of the teeth which is worn, and you can see that as we get into the adult, we have more marked wear of the adult front teeth. So somebody on the right hand side would now be committed to having veneers or build-ups after the completion of orthodontic treatment. Whereas on the left hand side, and perhaps the middle, if it's only a mild case, you don't have that wear. But this wear of the adult front teeth is something we see very consistent in deep bite patients. And the reason being is because with a deep bite or deep vertical overlap on the front teeth, the jaws simply have to undergo through a greater distance of motion when they're chewing, eating, and speaking. So in summary, an early orthodontic assessment identifies and addresses the jaw size and permanent teeth wear issues, and through the photos that I showed today, can save time and money in the long term. As a thank you for hanging around to the very end, I'd like to offer our listeners here today a very special offer. For those yet to start orthodontic treatment, they will be entitled to a complimentary free consultation valued at $85. Simply quote the code WEBINAR, WEBINAR, when booking. And we have a phone number. You can call us on 8814-9941, 8814-9941, or you can visit us on our website, www.greatsydneysmiles.com.au, and follow the right-hand side link to schedule your appointment online, or you can simply call us on the above number. Once again, thank you for listening, and I hope to see you all soon. Take care. Thank you.